Ritu ma'am. Yes, Ritu madam. Very
Yes, sir.
bright orange. Good morning.
Yes, sir. Sunny day.
Yes.
Yes, sir. Sir, it was really a very nice explanation with the practical demonstration about the, like, we are here in this part of the COMT, we are covering the regional part, that how we reach on that particular area, and after that, without any dysfunction, first how our assessment and evaluation takes place. That gives a very, very clear view today, that if we want to reach towards the thoracic spine, so there also how the sternum and rib cage plays a very, very major role in our evaluation and the assessment. So this the first part of our evaluation and assessment, where you have explained that how we can, the palpation skills gives us the major effect in our hand, that how we can palpate by going towards that, and after seeing that unilateral versus the bilateral, so that is very, very clear, that if we want to reach towards the facet joint, if the patient is having a problem related to the unilateral side, so how we assess the facet joints, which gives us the idea as a unilateral, or if there is a bilateral asymmetry is there, or how the interdependence of cervical spine can play a major role with the thoracic spine, because we always see thoracic spine as a bridge in between the cervical spine and the lumbar spine. So maintaining the position of that bridge, it is very, very important to assess all the part, the spinous process and the facet joint and the costo transfer joint. So these plays a very major role when we assess the thoracic joint point. And here the movement related to the sternum gives us the idea that how keeping the hand on the sternum, not giving the movement on the sternum. This is the just give the stability to the sternum, and then we assess on the thoracic spine. That gives us a clear view that at what point, at what level the thoracic spine is the stiff, and if that thoracic spine stiffness is influencing with the rotation or with the upper limb activity, then we can assess that either the upper limb dysfunction is related to the thoracic spine. So our assessment goes towards that the thoracic spine. So this is very, very clear, that how we do the assessment, or how we keep our finger movement on the facet joint or the costotransverse joint. That also you have shown, and which by the Satish sir was also simultaneously explaining that how we can keep and we can palpate level by level. And then we decide that what is the position which is like in the sitting is always a better for treating the thoracic spine. We can easily evaluate all the level, and or according to the modification, we can use it on the prone position, which you have explained. And all whenever we are influencing the flexion versus extension of the thoracic spine, so how we can take the spine to the neutral and how we do the progression there. Also, we are having a flexibility of using wedges, which we keep on and making the flexion, and we use the extension also. So these things are also very much clear, that because I have seen so many patients where when we have treated the thoracic spine, that has given a better result for our treatment for the cervical spine also, or the patient who are having a problem related to the shoulder, after treating the thoracic spine, their range of motion, which was restricted previously, was improved. So it means that treating of thoracic spine as a regional interdependence with the cervical spine is also very important. And after that, how we reach, because we know that the thoracic spine anteriorly how and the posteriorly, both their connection with the sternum versus the diaphragm is always gives us the better way to treat as a visceral part of the treatment, in the where we do the diaphragm release, we do the diaphragm fascia release, and we also facilitate the diaphragm. So that techniques are also very, very important. How we exhalation and inhalation gives us the idea how we can move inside through the every exhalation. Our hand movement is going inside. So that also you have shown in a very, very simple way, because after COVID, the diaphragm release is a very, very important part of our treatment, because when we are not able to make the map clear, that time when we release the diaphragm, that gives us the right view that yes, there was some restriction towards the diaphragm. Either the diaphragm was restricted in the exhalation position or inhalation position. So that also, and the beautifully you have explained the diaphragm release with the belt also, and with the TheraBand also. So that is also a very easy way for the physiotherapist if they don't have so much power in their hand. So they can utilize the belt as well as the TheraBand like me also. So we can utilize that TheraBand. And I have used this technique on one of my patients. So that was easy for me to use the TheraBand in compared to my hand. And the hand movement, that how is just like a curving with the hand, not with the fingers. So taking it inside the and just quick release the diaphragm, that also very useful technique sometime when we use for the releasing the diaphragm. So these things, all the three techniques are very useful. And with the belt and TheraBand and in our AMPT, this is a very important tool for all of the therapists of AMPT, the myokinetic tool as well as the TheraBand, which we always keep in our toolbox so that we can easily, if the patient is having a pain, so how the reciprocal inhibition through the TheraBand we can utilize it, and simultaneously we apply the fasciomuscular release, where we utilize the myokinetic tool to gliding the fascia and giving the contraction to the muscle. The same with the serratus anterior, you just shown that how we can make it with just giving the force, with pulling the force to making the antagonist of the serratus anterior. So these are the things which are really very important, which normally we were not adding in our treatment, but after understanding from your side, it becomes easy that yes, first we have to see that in which direction we are going to treat the patient. So there is a, what is the muscle which is antagonist, we have to be very clear in our pathomechanical part and as well as our muscle testing part or in our muscle testing course. So these things are very important. So I will say this is not a one course which you are explaining, the thoracic spine course. You are revising in between all the courses, the myokinetic course, the fasciomuscular release, the visceral course. So these are, or our TMTS course, the thoracic manual therapy course. So these are, there is the mixture of all the courses. So the people who have enjoyed and covered and learned all that courses, it is easy to make that roadmap. Yes, this was the technique which we have learned in that course. That was the technique which we have, so that we can make a chart that yes, we can utilize if the patient is having a thoracic spine related pain. So it is very important to take these courses which are always as a structure based, like the cervical spine course, thoracic spine course, lumbar spine course. So they are very important course because they are the road when we are moving towards the extremities, upper versus the lower extremity, or the articular, myofascial and the neural symptom. And in this also you have added the long sitting position, where the slump position, how we can connect that the neural symptoms were aggravating or relieving that pain of related to the articular structure like the thoracic spine. So that also we can go through the neural component. So here also the articular, myofascial, neural, all the component with the structural versus the regional interdependence you have added all. Until now, I think it is a very smooth journey for understanding about the structural way of understanding about the thoracic spine. So thank you so much, sir. And all the points which you have mentioned are really very important. And whatever you have explained till now is very easy. And as the sir was also practicing with you, the Satish sir, so it was also giving the second term that yes, first you were explaining, then he was using. So that was giving the revision simultaneously. And after that, they all were practicing on each other. The third round also, that giving the clear view that if one is missed, second is missed, then we can clear it with the third one also. So thank you so much, sir. It was really a nice session from your side. And one thing which I have really liked today, that how if the patient is having a thoracic spine pain, so with the TheraBand, how we can activate the erector spinae through the cervical spine muscles, and then we can give the treatment for the thoracic spine also. So that was also very important point which I have remembered in my brain. So thank you so much, sir. And thank you everyone who all are learning there. And definitely in all full day journey, we will learn more and more about the thoracic spine. Thank you, sir. Yes, sir.
Okay, right. So we are now on scheme to continue our demonstrations and practice. So we'll close this part of the clip.